Welcome to session 3 on weightage and blueprinting. Now in this session, we are going to understand various concepts of how to create a weightage and a blueprinting in context of medical education assessment. Then the need for systematic allocation of marks, that is the weightage based on different learning outcomes, different chapters or the competencies which are listed in the CBME document. To develop an assessment blueprinting aligning with the learning objectives, teaching methods and assessment tools. To design a balanced question paper with appropriate coverage of course content and the difficulty distribution. Prepare a chapter-wise theory paper weightage following NMC guidelines. And finally, you can develop a sample blueprint for your subject or unit within your discipline. What is blueprinting? It is a map or a specification of assessment items which is based on the educational outcomes, what we call as the course outcomes and the program outcomes. And the primary importance of this is that it is supporting the validity of assessment regarding to mainly its content, that is the content validity. The overall coverage of the content is going to be appropriate. It acts as a valid tool to align the objectives with the assessment, which helps in distributing the weightage across different topics in your subjects. This process will enhance the validity as well as reliability of assessment by ensuring representative sampling of the curricular content, leading to a clear and more transparent evaluation. What are the benefits? It ensures that questions being asked in the examination are aligned appropriately to the learning outcomes or the objectives. It ensures that there are no questions that are out of syllabus. So if the content coverage is proper, it will ensure that the questions asked are in the syllabus whatever is specified, and especially the core and the non-core content also we should be considering while we are creating the weightage and the blueprinting. It ensures that the selected test items provide appropriate emphasis on thinking skills and assessment of in-depth knowledge. It is based on Bloom's taxonomy levels, different levels. We can create different types of questions. It ensures appropriate coverage of subject content and competencies, ensuring content validity. It makes assessment fair to the students. Hence, all the above supports to improve the validity of assessment, which is a very important principle or a tool to create a proper question paper. Now we'll try to understand how to develop a blueprinting. We'll go with 6 different steps. First is to define purpose and scope of your assessment. Then identify the content and the competencies. Categorize the content. Select appropriate assessment tools. Select cognitive levels based on Bloom's levels, and finally determine the weightage for the topics. The last one will be to create a blueprint by the paper setter, question paper setter. Now the step 1 is to define purpose and scope of assessment. That is, first identify for which phase we are doing it, MBBS, PY1, 2 or 3. Secondly, which domain are we assessing? Knowledge, skill, attitude or communication. So which domain we are assessing, accordingly we are going to create different weightage and different blueprinting. As of now we are concentrating mainly on the knowledge domain for theory question paper setting. So we are going to understand the marks distribution as defined by NMC 2024 guidelines. So it is already well described by NMC about the total marks, how it has to be conducted for formative, how many marks are to be considered for summative exams concerned to theory papers as it is given in the table. Like PY1 we have formative assessment theory 100 marks, practical 100 marks, summative theory is 200 marks, 100 marks each 2 papers, and summative practical is for 100 marks. Similarly, in some of the subjects we have little more practicals of 200 marks each. So this is already well defined by NMC. We need not again redefine it, but however, formative assessment 100, how we are going to calculate 100, how we are going to subdivide the formative assessment into different internal assessments or continuous assessment, that has to be planned. Step 2 and step 3. Step 2 is to identify content and competencies. Again, this is made very easy for us because it's already well defined by NMC 2024 guidelines. Categorizing the content is the competencies which are described as core or non-core. One thing we have to keep in mind is core topics can be assessed in both formative and summative assessments, and non-core topics have to be assessed in formative assessments only. So you can create a weightage and a blueprint accordingly. Step 4 is to select appropriate assessment tools. And now we are concentrating mainly on the theory written test examinations. So we'll concentrate on mainly the lower two levels of knows and knows how in the Miller's pyramid of competency assessment. And mainly in this we are concentrating on how to frame the questions for written tests only. So to know that, how to set the cognitive levels. These are the different types or categories of questions which are actually proposed by NMC 2024 guidelines. As per that guidelines, our university also has finalized this pattern for the theory question papers. That includes scenario-based multiple choice questions, structured long essay question, short notes are of different variety, few are applied integrated modules, then few are of recall and comprehension level. Short notes at com can be both comprehension and the higher level. Short answers will be of reasoning type, which are again at a higher level of application, analysis and evaluation. So cognitive domains are well defined here. Each type of question, each category of question is well defined, which actually fits to a particular level of cognition as per the Bloom's taxonomy, and hence we have to, when we allocate the weightage, the cognitive levels automatically will get defined. The percentage of higher orders or percentage of lower order will get assigned as per the weightage what we are going to create. The final one is to determine weightage for topics. This is the one which is important for written theory papers. For this, we have to assign proportions to different topics and competencies based on their importance and frequency. What is this importance and frequency? We'll try to understand that impact and frequency, how we have to allocate for our own subjects. Now, the criteria to understand the impact and frequency of clinical presentation or condition. If your subjects are dealing with mainly the clinical presentation or clinical conditions or the scenarios, then we can go like this. Impact is, if that condition is non-urgent, little prevention potential, give a score of 1. If it is very serious but not immediately life-threatening, give a score of 2. If it is life-threatening emergency with high potential for prevention impact, then give a score of 3. That is the impact, means that particular clinical condition, how important and how frequently it is occurring. Based on that, we are going to give weightage in our assessments also. So by doing this, what we are going to achieve? The common conditions what are seen prevailing in our own area, we are going to give more weightage for understanding and mastering those things primarily. So frequency also, if it is rarely seen, score 1, to very commonly seen, you can give score 3. Now there may be a question like subjects wherein we don't have so much of clinical presentations, especially when it is related to basic sciences. So little modification we can do to understand the weighting criteria here. Just go with the basic concepts. All that we are doing in basic science subjects is to make the basic concepts clear to the student so that he understands the clinical conditions appropriately. So based on that only we can give the impact. Like if the topic is less important to build the basic concepts to support the clinical condition, give a score of 1. If the concepts are very important to understand a clinical scenario in different situations, give with a score of 3. And the frequency are similarly given as 1, 2 and 3. So this is how we have to decide based on the frequency of that particular clinical condition and also the clinical presentations. So now this scoring will be given either competency wise or you can give it chapter wise. Okay. So for example, we will consider how to determine the weightage for the topics. Now first is to calculate the impact frequency product. What we are doing here, I have taken an example of physiology topics and we have considered system wise here. To make it easier for us, we cannot go competency wise because there are too many competencies if we go that way. So we can go system wise. If it is general medicine, if you want to go disease wise, clinical presentation wise, that also can be done. But you have to pull all those competencies together and then bring out that particular content. For example, now in physiology, if you consider different systems, I have taken example of 3 systems here: cardiovascular, respiratory, endocrine system. Accordingly, subjectively, we have allocated impact and the frequency as 3 and 3, 2 and 2, 2 and 3 like that. So after that, what we see, you take a product of impact and frequency. Cardiovascular system, high impact, high frequency, 3 into 3 is 9. Respiratory system, 2 into 3, we have given it as 6. If it is general medicine, if you see impact is also too high, you can give 3 into 3. But because it is physiology, maybe content wise they have given it as 2 into 3. Endocrine system, 2 into 2. If the frequency is too high for certain conditions, you can make it 2 into 3 also in general medicine if you are considering. Now once you know this impact into frequency product, we have to give the total of it. Calculate the total of that particular impact into frequency product. After doing the totaling, we have to calculate what is called as weightage coefficient. Means now I have to give it in terms of marks. I have to allocate marks to each system. So first we shall try to understand weightage coefficient. What is it? Means out of 19, if 9 is given to cardiovascular system, then out of total marks allocated, first you calculate out of 19, 9 is given to cardiovascular system, so the weightage coefficient will be 0.48. Then what you are going to do? Give the total marks for that particular paper. If the total marks allocated for theory paper, if it is 100, then calculate it for 100. So it is going to be 48 marks for cardiovascular system, 31 marks for respiratory system and 21 marks for endocrine system. Okay, so this is how you are going to calculate weightage based on the impact frequency product. See here, impact frequency may not match with the physiology or it may not match with the general medicine. It is subjective and you can decide your impact and frequency based on the clinical condition or if you want to go system wise. So sometimes what may happen, the competencies given in under physiology may be very less, so they must have considered it on a lower side for endocrine system. But if it is very high or too many competencies are to be addressed as a part of course outcome and looking at the frequency prevalence of such a clinical condition, it can be given more weightage when it goes to general medicine also. Now this is how chapter wise weightage for the contents are allocated. So if you see example for the summative exams, if you have so many topics described, then we can create a weightage like this. One few points I wish to inform you here regarding the general considerations, what you can consider, which may be better to create a weightage. You can restrict the number of topics to less than 10 in each paper, because if you create too many topics, subdivision of the topic, small mark allocation would be very difficult. And restricting this will improve the validity rather than giving more number of topics and little marks for each of the topic. So by restricting it, it improves validity. Many of the subjects may give a single number as a weightage, like for example 10, 20, 15 like that. So that is also acceptable. You can also give it in the form of weightage in the form of a range. If you are giving a single digit, then some flexibility has to be given to the paper setter. So you can mention that 20% variation is acceptable, 15 or 20% variation is acceptable. Now, that is for summative assessment what you saw. Now, for internal assessment also it is very important to create weightage, because there are very few topics which will be covered for internal assessment. See, for example, only 4 topics are covered for first IA. Then how are we going to calculate weightage? Now we have 4 topics: general physiology, hematology, GIT, muscle and nerve physiology, which are covered for first internal assessment. Then what we are going to do? We already have a weightage for summative assessment. So from this you take an average. If it is a single digit, you can take it directly. Okay. If it is in the form of a range, you take a single digit, average it out and take a single digit. After you take a single digit, then what we have to do? You have got all the average here. Okay. ATCOM also is to be included, 5 marks, that we know. So if you want to include ATCOM, how we have to calculate the weightage, that I will show it to you here. So 5 marks for ATCOM is fixed. So out of 100 we have only 95 marks to be allocated to these 4 topics. So now we shall try to allocate it to only 95 marks. So first total all the average marks, you will get 55 when you total it. Then weightage for topic 1 will be, out of 55, general physiology is 7, into total marks allocated for first IA, we will consider it as 95, leaving out that 5 marks for ATCOM. So if you consider it for 95, it will become 12 marks. Okay. So like that for topic 2 and 3, which have 18 weightage, out of 55 it is 18, so out of 95 it is going to be 31. Topic 4, out of 55 it is 12, so out of 95 it will be 21. And finally topic 5 is fixed, which is 5 marks. So you will get the weightage like this for a 100 marks paper. Okay. So now if you give a single digit like this, give 15 to 20% variation is acceptable, or you can give it in the form of a range. Okay. This is how you create weightage for individual internal assessments. It is very important to create weightage for all the assessments what you do. Otherwise, the content coverage may not be appropriate. This is the sample blueprinting of the question paper, which has to be filled by the question paper setter. Now you know here we have to list the topics and weightage, which is already fixed by the university or by the department. And now it is left to the question paper setter to decide which type of questions he will be allocating to which particular topic. So long essay question may be specified from which topic it has to come, but all other questions have to be decided by question paper setter only, and then it has to be marked in this particular table. Okay, so here the general consideration is this has to be filled by paper setter to ensure that appropriate weightage is followed. Topics for structured long essay question may be specified before itself. Topics for 2 scenario based questions, short note question, are specified by NMC, so they have to come from 6 integrated modules only. Remaining questions may be decided by the question paper setter. So cognitive levels of questions are already fixed as per the NMC guidelines. Almost all are coming under different categories of Bloom's taxonomy, which are fixed. So need not worry about those things, because short essay question recall and comprehension will always be at level 1 and level 2. SAQ at reasoning type of question may always be at a higher level. So according to the groups of these different questions, the Bloom's taxonomy levels automatically gets fit into different types of questions. Thank you.